Welcome back to MindMomBodyRN.
Hooray!
Hooray! And I'm Rachel.
I'm Sophia.
Yeah, welcome to the MindMomBodyRN podcast.
Who are you interviewing today, Rachel?
A dear friend and actually my own OBGYN, Dr. Cassie Albertin.
Gasp.
Don't front, you know her. Don't cap.
No, I do.
Yeah, don't cap. I just learned what that meant, so I wanted to say it a lot. Yeah.
Do you feel hip?
I do, yes.
I'm glad.
Yeah.
Can I tell you a funny story?
Yes.
Okay. All right. So I had this little redhead, and we're going to call him C. We were in to go potty. He had recently been potty trained. Everyone else is on the playground. So I'm, sitting there waiting with C while he's on the potty. And it's been 10 minutes. C, like, what are you doing? And he goes, oh. And I said, what's wrong? Are you okay? And he was like, my poop. And I said, your poop what? He said, my poop is all tangled up. And I said, what does that mean? And he said, oh, my poop, it's all tangled up in my butt. It won't come out.
Oh.
Yeah. And that's how he described constipation, was his poop was tangled up.
Did you talk to mom?
Oh, it was mom's verbiage.
Oh, okay.
Yeah, he did a way better job drinking his water once I knew that I could say, hey, C, gotta drink your water so that your poop doesn't get tangled up.
Yes.
Yeah.
Using that with my kid. I love that.
Yeah. And then he'd go, oh, yeah.
Oh. Totally using that. Okay. Yeah. I think that's the perfect note to jump into this interview with Albertin. Wait. All right, let's go. So thank you for being here.
Thank you.
So this is Dr. Cassie Albertin. She works for Metro Partners, and she is my OBGYN. She's been my OBGYN for 8 years now. Six.
The time flies. Yeah.
Yes. So she actually was, what we're going to talk about is kind of like the journey that I made. I used to be a home birth midwife, and I started out with you like that. I was going to have a home birth, and I was just coming to see you just because I think I was like, maybe this isn't a good idea.
Yeah. I remember you actually saying that. Like, I'm a home birth midwife, but I kind of also want to hospital care.
I did.
Yeah.
And that's what I wanted. And it was amazing because it's like I have literally caught or helped like almost less than 200, but almost 200 out of hospital. Like that's not even counting birth center. You know what I mean? Like home births. But that's like just not what I felt good with.
Yeah.
It was like, and you have to go with like what you feel good with. And I knew it's like I knew I need to like be with an OBGYN that I trust.
Right.
And so it was like I had this innate thing, but like it was really hard because like I'm part of this community, and Dr. Cook and I were just talking about how you kind of, the thing about the crunchy granola community is that it's like very villagey. It's very like, we love you, like we're part of this, let's just like nurse each other's babies, and so like kind of it feels like this big mom hug, but then like there's all this propaganda of like other things like anti-vaccines, like these doctors are trying to corrupt, like, you know what I mean? They're just, everybody's
assault
evil.
You and right.
Everybody's trying to just get you on pit and get your baby out of you. And it's all a conspiracy.
Right.
So, but you kind of like, it goes hand in hand together because you like want the love. It's like a church, right? Almost is what it feels like.
You want the warm love mama hug that you're talking about, but you also,
And it feels good to feel passionate about something, but we're just picking the wrong things to be passionate about. Like we're picking the wrong hills to die on.
Right.
Is what, the problem is.
Well, and like birth is normal for a lot of people.
Right.
And we don't know who's going to not have a normal birth or when things are going to go wrong. I'm sure, I know you've seen that with like the midwife stuff, right?
Absolutely. And like, but the thing is too, is like as midwives, and I'm not saying that home birth is the wrong choice for every single person. I mean, if you literally fit all the low risk categories, you know what I mean? Like you're low risk here, and here, and you have full informed consent, and you know what I mean? And you are with a skilled, licensed, board certified midwife. I'm not trying to throw shade. You know what I mean? But like, we need to have a talk about these lay midwives and just practicing the art of midwifery, and all of us trying to just catch babies in the rogue because it makes us feel powerful. Like there's a reason that we have like exams. There's a reason for board certifications. There's a reason for
Right. There's checks and balances.
Right.
Right. Yeah.
For total, and yeah, but it's just, we were talking about like this journey. So I was kind of at that point where, I still wanted and I was embarrassed that I was seeing an OBGYN almost.
I remember that because you were like, I'm not telling anybody, but, and this is like, if I would have told them, like I would be judged by, it was
horrible
for it. Yeah. I remember that. Yeah.
Yeah. And like, that's so not cool either. It's not cool that I felt that way either. Like, I mean, people, and so often in that perspective, it's like everybody wants to get after like home birth people, whatever. But like, it's hard when you identify, you know what I mean, with that community to be like, this is what I want. This is what and then what happened? I turned into like needing all of that stuff.
Right. Right. I mean, that's exactly, I don't want to say like that's exactly how that happens, but you never know when it's going to happen. And so anyway, you need somebody who can identify that too. If you're going to go like a home birth or whatever, you need somebody to identify when things are not going right.
And we had like a lot of conversations about just like, because we saw kind of my preeclampsia creeping up and it was very strange because it was right after I had, not right after I'd had Eloise, but probably 4 months when I was just finishing up like those last few births. And I literally saw someone who was me having a baby. And I think we've talked about this. She had a full eclamptic seizure.
Yeah, it didn't go well.
It didn't go well at all.
Yeah.
It didn't go well at all. And it was like looking at myself of like what had happened, what would have happened if I had not followed like that, like that voice I had inside me being like, you need to go do that,
Yeah.
And
goosebumps.
Yeah, right.
Like, literally,
it's terrifying.
Yeah, it is.
And I watched that and I literally just, it was like watching myself of how that could have freaking unraveled if I wouldn't have had like the interventions that I needed.
Right.
And that's like, really, I mean,
but go through like the labor journey even because it's not like for that first one it was
insane. So I'm so literally like I go into, I'm 34 weeks, but I had been getting high blood pressures. It had been a while. Yeah. So I had been working crazy hours and I had finally said, like, I need you to write me a note. I've got to get on like modified bed rest.
Yeah.
So I get on modified bed rest and then like still it's just like creeping up. And like you had a vacation plan forever. Not that like I would have expected you to cancel that.
Yeah.
But you leave me with Freed.
Freed and Candid.
Who were like, but Candid wasn't with Metro Partners then. So I just got so lucky that I got her.
Yeah.
But you leave me like with Freed and I go into the clinic and I have this like insane blood pressure and Freed's like, you need to meet me at the hospital. I'm like, okay, I've got to go get a Brazilian and get a pedicure though. And Freed's like, no, you're not going to do that.
Yeah.
And I'm going to do that. So I went and I did that.
Oh my gosh. That happens a lot though. You'd be like surprised at how many people will do that. Right.
Right. And then like now, like, and it's just like, what was like, I can't even believe it now as a full provider, like looking back on what I was doing, like, oh my God. So I get there, like blood pressure is really high, but like everybody's working with me. I really truly believe that I'm at the place I am now because I had such a compassionate and like understanding group of people. Like you never judged me.
Yeah. I mean, because where's judgment going to get somebody? Then they're going to feel judged and leave, right? And then they're going to be back getting not the care they need, right? So judgment doesn't help anything.
What was that like for you, though? Because I was spewing like absolute fucking bullshit. Like, what was that like for you to be like...
I hope to think that I at least kind of brought you back.
You did.
Right?
Yeah.
Sometimes being like, okay, but there are some things you can meet somebody like halfway on, right? And a lot of things you can compromise on. And as long as you know the risks and things like that, just like Meg in the bathtub.
Or for like a big one for you that you compromised with me on is because I was convinced for a while that ultrasounds caused autism. So I remember I was like, I'm not doing a 20-week. And you were like, I just need to see that the head's down. Like you like, or no, it was
something to that effect. Correct. Yeah. Like I
you were
remember
like, we can
this.
put it on. You were like, I'll even stand next to you. We can put it on, see the head, and take it out. You were so willing to collaborate with me that I was just finally like, well, let's just do a normal C-section.
Yeah. Right. I mean, like, and
a normal ultrasound.
Normal ultrasound.
A normal ultrasound.
The C-section comes later.
Yeah. Right. But I was just like, let's just do a normal ultrasound because it was like you were so willing to collaborate. And I think as like healthcare providers, like if patients don't feel like we're fighting them,
right,
it's so much easier.
Right. That's exactly it, right? Because just like I was saying before, if you feel judged, then you're not going to come back, right? And it's not like, oh, just tell them what they want to know just so that they come back. No, it's not that. It's just every birth experience is kind of your own, right? Or
no, exactly.
Yeah, you got to collaborate.
Yeah, and it was like that you were willing to do that. And I remember it's so funny now to like think of all the things I said to you, and you were willing to collaborate with me on everything. You were a saint, dude. You were a saint. I was a lot. I was just
That's
like,
okay.
Yeah, you.
The diabetes thing comes up a lot. It's not just you, right?
Right.
Was it that you didn't want to do the like glucose test itself, or was it that like?
It was that I didn't want to drink the glucola, even though like my fucking ass will eat gummies and drink like, you know what I mean? Orange Crush pop.
Right.
But fuck it, I'm not going to do the glucose test.
The Orange Crush has definitely more sugar than a glucose test.
For sure.
Yeah. But people do that all the time. And I don't want to say all the time, but a handful of people do it. And, you know.
And it's like, but.
Big deal.
Yeah. And I was like, well, can I just eat like jelly beans?
Yeah,
that have
you
the
brought
same-
a whole list. Right. Yeah. Like it was like 3 Twizzlers or like a couple of jelly beans or whatever.
Right. Now understanding like we have no data on like testing with like sugar in that form. Right.
Yeah.
I get that now as a provider. But at the time I'm just like, fight me on it. Let's do it. What are you going to say? And you were just like, okay.
Okay.
You were just happy I was taking the test.
Yeah, right. Because so many people, honestly, if people don't, then I set them up with a glucometer and then they check their blood sugars fasting 1 hour after meals for a couple of weeks and then have them bring it back in. But that's expensive and it is a lot of time commitment and it sucks. Yeah, like if anybody's ever checked their own blood sugars, it's not like fun poking your finger every so often.
No.
So anyway, it's fine.
And
because everybody has their own opinions and it's
but you were willing to like take what you could get too. You were willing to be like, and like seeing that now, I would have done it too. Like some information, even with this form, is better than no information.
Right.
Yeah. You're very wise.
Thank you.
Yes. Like I understand
so
now.
funny.
Great sensei. Like
yeah, right.
Yeah, where you were coming from. It makes a lot of sense. Okay, the one thing I wanted to talk about is like, and this was never an issue with me, but like patients that refuse the STI testing in pregnancy.
I've never had somebody refuse it. Literally never had anyone refuse it.
Okay, lucky
but
you.
That was like it's a regional thing. So I was talking to some other docs on the other side of the river, and they actually not even on the other side of the river, and they said they don't routinely do it at the first OB visits. And I was like, that is something that is definitely recommended. And like, just because somebody's married doesn't mean that you can't just assume anything, right? And I've definitely more than once had patients that have been married for 10, 15 years that have had STDs that we just routinely tested as a part of prenatal labs and found it.
Yeah.
So, and then, so it's like a thing. But I've otherwise never had somebody who refused it.
One, I'm so happy about that. Yeah. Two, like the entire population I had for a while refused it because they would just be like, well, I know my husband. I know what, like.
And then look at the Minnesota syphilis rates. I mean, the reason that we have to test now, like first OB, 28 weeks and at the time of delivery is because we have so many more congenital syphilis cases in Minnesota now which shouldn't be a thing. It's totally treatable. Yeah.
Absolutely.
So
what she's talking about is, so the public health basically tracks how how many STIs there are, and they like report, like with women, let's say like in this specific region of the country, there's a much higher incidence of this particular STI. So what she's talking about is in Minnesota, we've had a much higher incidence of syphilis rates in pregnant women in the past 3 years? 4 years?
Probably 3 or 4 years. Yeah.
And it's amazing how many women are coming back testing positive for syphilis that were testing negative in the first trimester.
Right.
And it's just wild. And so
in fact, like we had to switch how we do our laboratory testing for syphilis, because there's a screening test and then a confirmation test. And now all of the labs in the state of Minnesota said, we just need to do the confirmation test right off the bat and not even screen, because we have so much of it that it's not worth the screening test.
It's
kind of crazy.
And
preventable.
And so preventable.
Right.
So preventable. So that was
treatable.
Yes. So that was one of the things I actually wanted to talk about. So there are like a lot of couples right now that like are not necessarily monogamous, right? And there are a lot, it's super common now.
Super common.
Couples that like have kids, full families that aren't super monogamous.
Open relationships, polyamorous.
Yes, absolutely.
Thruples, yeah.
So if you have like one person, let's say that you're basically like fluid bonded to, right? Like they're the person that you're whatever. What are some ways that like women can, or not even women, but just like people, how can we like keep ourselves safe if we like have one partner that we're committed to, but like people are also like,
There's a lot of things. I mean, obviously, you can go through the like normal stuff. Condoms, right? Condoms prevent STDs, things like that. Not everybody uses condoms all the time.
Right.
If you're not going to use condoms all the time, getting tested regularly is one thing. Getting treated like right away. And in most states, there's EPT, expedited partner treatment now. So gynecologists can send in prescriptions for partners.
Thank God for that, by the way.
Right. Because not every state has it, but most states do.
But also like stay off of each other for just like a hot minute if you both test positive, because
to get the treatment, right. And your other partner too needs the treatment too. And then you go into like PrEP and things like that for HIV.
Right.
So that's a whole other conversation.
So like PrEP is a drug that people who are at higher risks for contracting HIV, let's say that you are working as a sex worker.
Yep. Or like in jail, or partners of people that have HIV.
Right.
Although the risk of transmission, if like your partner is treated for HIV and have a low viral load or negative viral load.
Which is why we want to get tested, because then we can get on top of these things. So that way it's like, if you have HIV, okay, it's not the death sentence that it used to be.
Correct.
But like, let's get your viral load under control so that like you can sleep with your partner without transmitting it to them, transmitting it to other people, and also that you can like live a healthy life and not die of AIDS.
Right. Same of a Hep C too.
Yes.
Like Hep C, hardly anybody tests for, which is crazy. It should be a part
curable.
Right. Now, I mean, it used to be not.
Right.
I mean, more recently than HIV, right? One of those things that people like don't think about and forget about.
Much higher incidence of that. And also like the prevalence of understanding like needle exchange programs, like, and understanding like what we have access to. Because just because like someone's struggling with substance use or something like that doesn't mean that like you can't be safe.
Right.
It doesn't mean you can't protect yourself. It doesn't mean any of those things.
Right.
And also like if you are having like regular encounters with other partners and you're not using condoms, just like the regular testing, can you talk about that? How like early intervention, what a difference it can make?
Early intervention with...
In terms of early treatment of any STI.
I mean, just kind of like what we were saying, if you get tested regularly, you're going to prevent pelvic inflammatory disease, infertility issues potentially in the future, especially with gonorrhea.
Cancer.
Right, exactly. I mean, HPV is an STD or STI, whatever, right?
Right.
And so... but 80% of women have it in their 20s. And that's why we don't even test for it in your 20s, because we just assume you have it.
Right.
And so...
and there's no test for men for that, by the way. Like,
right.
Unless they're symptomatic.
Right. And the Gardasil, the vaccine, covers 9 strains, but like there's hundreds of strains, right?
Please give your kids the gift of the Gardasil vaccine.
Right.
Please. If you're going to do anything for your kids, take care of their skin, take care of their teeth, get them vaccinated.
Right.
Like, please do those things.
It's
Don't hit them.
one of the safest vaccines in the world, actually. So, and other countries that were early adopters of it and really vaccinated their kids have very, very low cervical cancer rates compared to the U.S.
I think about like, because I was part of kind of like, I grew up in like an evangelical church group where I thank God my pediatrician, I remember him advocating for me to get the Gardasil series. And I remember that it was a big topic at church. Like, if our girls are remaining pure until marriage, if they're following the rules, they shouldn't be at risk for it.
You're going to have more sex if you have the Gardasil vaccine.
Right.
My parents were just so cheap that they were like, it's going to cost us money because insurance wasn't covering it back when it first came out. I'm a little older.
Yeah, you're barely.
Yeah,
okay.
But
you're
still old enough that like
4 years. That's it.
Right.
I mean,
but it definitely wasn't covered as like routine preventative care when it first came out, which is crazy. But anyway.
And it's hard too with like it being a series because like, you know what I mean? Like it's
the younger you get it done though, it's only 2 dose rather than a 3 dose.
Is that right?
I think it's like 10 to 12, 10, 11, 10
I'll
to
give
11 year
Eloise
old.
the Gardasil vaccine right now. Like, you're 4 years old. I will give it to you right now, girl. Like, HPV is no joke.
Yeah, right. I mean,
and just the fact that those like the strains that it protects against. And this is a little bit anecdotal, but I think about, like I was saying, like I grew up in that kind of. So I think about my friends that didn't get the Gardasil vaccine. And they are the ones that are struggling now with infertility, that are struggling with like all of the issues that come along with, you know what I mean?
HPV, I don't know if HPV causes infertility issues. It's more of like
I'm thinking about one specific person who had like one specific.
Yeah, I was like, I was like, it can lead to stuff that needs a leap, which is like a larger excision. And in the past, they think it's more associated with preterm birth and things like that.
That's what I was more thinking. So this person was not able, like even with the cerclage, was not able. So a lot of.
Yeah. I mean, you've got to do a really aggressive leap, I feel like. I haven't had any of my patients, like, knock on wood, have a preterm birth after a leap, but how we used to do them was a lot larger than we do now. So anyway.
Yeah. So the whole, like, circling back, the whole thing with that is, like, get your kids the Gardasil vaccine. You said your parents were too cheap. So what I was saying is, like, I had this pediatrician. Dr. Vladiver, shout out. I know you retired. But he was amazing. And he advocated so hard that, like, I was young and that I wasn't, I was into Harry Potter. I think I was still like into Barbies or whatever, you know, like, but he advocated so hard the importance of getting that vaccine. And of getting the series and like pushing my parents to like do that. I'm so grateful for that. Like, because it's like, no, it's just important.
Right. I mean,
yes.
A lot of vaccines.
A lot of vaccines. Everybody should get their vaccines.
Yeah.
Yes.
I mean, we could go on and on about all the vaccines and pregnancy and all that stuff now. But anyway.
Yes.
Yeah.
Yes.
Okay.
Thank you so much.
Of course.
I know. And I'm your favorite patient, right?
I mean,
obviously.
In the top 10. How about
10.
that?
Okay. I'll take it. Okay. Will you come back soon?
Of course.
Okay. Thanks, Cassie. Appreciate it. I love her.
Yeah, she's really great.
Oh my gosh. I love you, Cassie Albertin. She is just...
Shout out, Cassie.
Shout out. We love you, Cassie.
Do you want to do a mommy mailbag?
Yeah, just one mommy mailbag.
I'm going to read you one.
Okay. Is it a good one?
Yeah, this one's perfect for you. Okay. This is Rose from PA, Philadelphia. Yeah, PA's Philadelphia.
Yeah.
Rose has a 2-year-old and is expecting a baby in a few months. She says, my 2-year-old hasn't been interested in my belly or the idea of a sibling, and I'm worried it's going to be a huge shock. How do I prepare them?
Yeah, it's going to be a huge shock. It's going to shock you. It's going to shock... I could do a whole episode. We say this about every topic.
Yeah.
It's going to shock you. It's going to shock them. And you are probably like looking at your child right now thinking, how in the hell am I ever going to love anyone as much as I love you? And it's. And you know what? They're literally thinking right now, like, this is very strange. I've never experienced having a sibling before. Everyone seems really excited about this idea. I don't know if I feel safe about it. It's new. So I guess what I would recommend is what we did. We got a baby doll And we called the baby doll by the name that we were planning on naming the baby. We with our first kid, we didn't totally name her till we saw her, but just for the sake of like understanding and stuff, we got a baby doll and named it Baby Kendall. And she would help take care of it, and we would model it, and then I would let her pretend to be the baby, and then just a lot of together time. And a lot of attention and a lot of like investing. Like if you think about your kid's emotional bank account, like they really do you've got to invest a certain amount of time. Like whenever there's going to be a big change, like, I took Eloise out of school for 2 days to spend them just straight with her before I knew I had my scheduled C-section. So I think just modeling it and then also calling the baby our baby. I'm so excited to meet our baby. We're going to love it's our baby.
To encourage her feeling like
yes,
she's part of that process.
And Kendall has always been Eloise's. She's always referred to her as my Kendall.
Yeah.
And so, that's what I would say is just whenever you don't know what to do, just do everything you can to love them harder. Yeah.
Yeah. I think I really love the baby doll tip.
Mm-hmm.
It's really good advice.
Yeah.
There's so much more advice we could give you, especially if we know more about your child. So please
contact us for consultation services at
Yes.
MindMomBodyRN.com. We are really the gurus at it. We're the best. So, okay, I guess we're going to sign off. Until next time,
take care, Mama.